Limited access to comprehensive health education for adolescents in the Gambia is a growing concern education officials aim to tackle through an expanded program increasing awareness on reproductive health issues. In 2021, the International Development Research Center funded a project implemented by the Ministry of Basic and Secondary Education to strengthen access to quality comprehensive health education in Region 1. This forum, bringing together stakeholders to discuss challenges impeding reproductive health education, engages a youth network to strengthen access to quality comprehensive health education information among in and out of school adolescents in Western Region. Khalidou Jallow, an education officer at the Ministry of Basic and Secondary Education, disclosed that comprehensive health education should be everyone's business, highlighting the importance of the curriculum.
To health generally, I think everybody should take up responsibilities. And if you look at the research findings, there are suggestions that are made. So we expect the general public and or whosoever who come in contact with the research findings to adhere to the recommendations that are presented there to better sensitize the society, especially the unprivileged, to access the research findings, to pay attention to some of the recommendations in the research findings.
Fabian Inagrand Sagna, the principal investigator at the Comprehensive Health Education Department, stated that the reproductive health curriculum will be advanced outside schools as a crucial pathway to engage stakeholders in discussions to develop the program.
It is important. Nowadays, you see how society is. Students, how they are. If they are not educated, if they are not well informed, there are a lot of disaster coming on. They need to know who they really are. Most are engaged in a lot of sexual activities, but they don't know the consequences behind it. So we invite in community members because it's in and after school. So we also invite the religious leaders, the cultural leaders, the imams, the alcalolos, all will be invited and they will give us ideas on what to say. So we have really seen a lot of things. So today we have the CSOs and the NGOs, the new and the old CSOs. You can see they will give us their recommendations and then we can partner and do the implementation together.
Mrs. Sagna added that the course will inform adolescents on how to protect themselves during puberty and other development stages to understand the basics of sexual health.
So we're talking about different aspects when it comes to health, sexuality or health education in the Gambia. Though Mobse, they have established and created what we call a framework, and framework have a lot of components in it. It has body and puberty, it has reproductive health, guardian and counsel, society and culture, values and attitude. And when it comes to the sexual reproductive health matter for the in schools, talk about menstrual issues, talk about unsafe and unwanted pregnancy, unprepared pregnancy, unsafe abortions, STIs, contraceptive, gender-based violence, and harmful traditional practices. So we conducted research in the schools in Region 1.
Over 300 teachers have been trained on comprehensive health education to expand the scheme in a crucial effort to implement the program's objectives. Alajimbai, GRTS News.